On this episode, we'll talk about what vegetables to eat. We'll also talk about stalls after a month, and we'll talk about how many calories should you be eating. Hello everyone, I'm Dr. Alvarez from Endobariatric, and this is episode 66 of the AskDrA show. Thank you so much for being here with me. I'm here currently in Rio DeJaneiro, Brazil. We're here at the IFSO, at the World Congress on Weight Loss Surgery. Excited to be here. Good to see some of my good colleagues, and of course being able to give a little bit of what we've learned on the gastric sleeve to the world, and of course pick up a tip or two around the world as well. So let's get into the show.
What are some of the best veggies with the best nutritional value for us with sleeves?
All right, so if you're interested in eating vegetables, if you're interested in becoming more like a vegetarian, if you're interested in getting more into vegan lifestyle, yes, there are some vegetables that will give you more nutrients, and that you'll learn down the road. If you can pick up a few books. If you're interested in this, let me know. I've got quite a few of them. As you know, I've been vegan for almost over a year now, a year and a half or so. And but back to the question, the cruciferous group of vegetables will give you the most amount of nutrients, most amount of antioxidants as well. You're talking about cabbage, you're talking about cauliflower, you're also talking about broccoli, and most importantly, kale. Kale also belongs to that family. This group will give you the most amount of nutrients. They're superfood here, and gives you a lot of antioxidants as well, protects you against cancer, and will give you the most out of eating vegetables.
Is it normal, knowing that every journey is different, to have my first stall 1 month after surgery?
Now, talking about stalls, stalls are normal. We actually posted a very nice quote on our Instagram today, and it talks about stalls. It talks about adaptability of your body. It's totally normal and expected. If you're freaking out if you had a stall after a month, this is totally normal. Sometimes it comes sooner than a month, because it all depends at what point you started to lose weight before surgery, your pre-op diet, and your starting weight, your age, your activity level. It all comes into play here, and so all this is normal, expected. Remember, your body is going under a lot of stress, transformation. It needs these stalls for adaptation, for your body to shrink down, to lose the sizes, adapt to your body functions, and then continue. Don't freak out. Remember, this is a long journey of 12-18 months. You need patience here.
How many calories and carbs are we supposed to be eating starting soft food?
All right, so how many calories should you be eating at this point if you're a month out? All right, let me give you a little bit of the rounded numbers here. Right after post-op, between month 1 and 6, you'll probably be doing between 600 to 800 calories a day. After 6 months, you'll probably pick it up between 800 calories to 1,000, and it stays that way. And maybe after a year and a half, it could go up to 1,200 calories or so. These are estimated numbers, rounded numbers. It all depends if you're a man, woman. Men have larger stomachs because they're longer. It all depends on your surgeon, on your surgeon's technique. It also has a lot to do with that. On your bougie size, the bougie calibration tube your surgeon used. All these issues come into play on the amount of calories that you will be consuming afterwards. But to give you an estimate, those are the numbers. Get yourself to those numbers. The best way, as I've said before on the show, best way is to count your calories, and to do so you need an app. Download an app on your phone to count calories. You can do MyFitnessPal. That's the one I use. I like that. And you can type in, log in everything you eat. That way you have an idea of how much you're eating and when to hold off, okay? All right, so that's it for episode 66 of the Ask Dr. A show. Thank you so much for being here on the show. Don't forget to send me some questions. If I don't have some questions, I'll probably skip next show if I don't have some questions. I need some questions, all right, guys? Question of the week is, do you count your calories? Have you been counting calories? Yes, no. Answers below on the comment section. I'm Dr. Alvarez from Endobariatric. I'll leave you here with a little bit of Rio de Janeiro, Brazil. I hope you enjoy. Take care. Bye-bye.